All right, so in this is part four, we're going to talk about looking at the body, looking at the human body, now from an anatomical perspective. So, um, one very critical and vital part of learning anatomy and learning different body regions and whatnot is understanding something called anatomical position. Okay, so what anatomical position is it is a standard um, way and standard approach of looking at the human body uh, in an attempt to avoid confusion between different people um, and whatnot. You always refer to the body in anatomical position. So if you say something is medial to something else, if something is posterior to something, if something is superior to something else, it's always in the context of anatomical positions. You don't have to ask, well, are they laying down? Are they sitting? Like what do they look like? It's always an anatomical position. An anatomical position is always the following characteristics. So they're going to be standing upright, right, on their feet. Their feet are going to be parallel and facing forward, right? So they're not going to be splayed out. They're not going to be kind of pigeon-toed pointing in. They're going to be straight. Their limbs are going to be straight down to their side with their palms facing forward, right, with their fingers open, their hand open. Palms are facing anterior, as we said. The head is going to be level, so you're not going to be looking at the ground. You're not going to be looking up at the sky. You're not going to be looking to the side. You're going to be looking straight ahead, so eyes looking forward and head is level. So just like this image here on the right of the screen, this is a good example of anatomical position. This image here is also a good example of anatomical position, right? Our arms are straight down to our side, palms open, facing anterior. Our head is level, eyes looking forward. Arms are down to the side, legs are straight down, feet flat on the floor, facing forward, right? So this is a very good example of anatomical position. And with anatomical position comes an anatomical left and an anatomical right. Okay, and again, and this is whether you are if you're going for nursing, if you're going for physical therapy, occupational therapy, whatever you're going for in the health science professions, if you are, um, you're always going to refer to the sides, left and right, from the patient's perspective, right? From the cadaver's perspective, from the model's perspective, right? So when we look at this image here, this is our right side over here, but this is the patient's left, right? This is the patient's right side, but this is our left, okay? So it's always from the patient's perspective. Now, obviously, if this person was turned around in the same position but just turned 180 degrees and we're looking at their back, then their left side would also be our left side and their right side would also be our right side, right? So you have to orient yourself to what you're looking at and then make a determination from there, okay? So when we look here, if we're looking at the body and then we're looking at an example of an imaging of the body, and this is saying click on the right kidney. Well, click on the right kidney using your information and using your knowledge of what anatomical position is, right? So if we're looking here, first off, what side is right and what side is left, right? Well, this is our left side, right here, and this is our right side, right? So we know if we're looking here, this is going to be our left, and this is going to be our right over here. So we have to now just go through and find what looks like the kidney. Well, if you know anything about where the kidneys are, they're going to be down kind of below our liver and spleen. So here's our liver right here. Here's our spleen right here. Here's one kidney right here on the left side, and here's our kidney on the right. So when we look here, there's our kidney right there, right? So always orient yourself to what it is you're looking at, and then you can begin the process of actually identifying different structures, okay? So we said again, this is anatomical position. Now this is anatomical position with lots of anatomical regions listed, right? Now this image on the right, this technically is not anatomical position because their feet are not flat on the floor, but this is just to demonstrate some of these anatomical regions down near the foot and down near the heel, right? But again, we're standing up, feet are together, facing forward, flat on the ground, eyes are forward, arms are down by our side straight with our palms open and facing forward, okay? Now, we have lots of anatomical regions that you'll need to make yourself familiar with, okay? And these are important because in a clinical setting, you're going to refer to these whenever you're charting, whether you're nursing, physical therapy, physician, it doesn't matter. You're going to chart um, in some way, and you're going to refer to some of these positions or some of these anatomical regions, right? And you chart them in this standard way, and you refer to them in this standard way so as not to uh, cause confusion between different people, right? So instead of saying the patient has a an incision on the front of their body, right? That's very, very vague. If you say the patient has an incision on the front of their body, right? Well, where on the front of their body? On their front of their arm, front of their head, front of their chest, front of their leg, where? So if you can be very specific and say, the patient has a 2 centimeter incision, 2 inches lateral to the sternum, okay, or 2 inches lateral on the left side of the sternum, or something like that. If you can be very specific, then the next person that comes in and looks at that patient or is caring for them, they can read your charting, read your notes, and go exactly to where you describe it, and they can see what it is they're supposed to be looking at. Okay. So if we look here, if we look around the head region, right, we have um, all of these different structures or body regions, excuse me, and these are going to be um, again important whenever you are referring to them in a clinical setting. So in parentheses, you see you have the common name, and then just before the parentheses, you have the anatomical name. So from now on, in lecture and in lab, whenever you're referring to it, use the anatomical name. Okay, so instead of saying the neck, say the cervical region. Okay, instead of saying the cheek, say the buccal region. Instead of saying the chin, say the mental region. Okay, so be specific with these and do not use the common name. Okay, now on some of these, there are some helpful little kind of mnemonics or different ways that you can help that will help you learn these if you want to use some of those. Okay, now some of them are very straightforward. Okay, in terms of the anatomical term matches up closely with the common term, or once you learn kind of what the anatomical term means, then it makes more sense, right? So the forehead is at the front of our head, so it is the frontal region, right? The nasal region is our nose. That makes sense. Now the mental region. This is a very good one to remember, and we'll talk about this in lab as well. If you are trying to contemplate something very deeply, right? You're trying to think a lot. You're trying to use your brain, your mental faculties, right? Oftentimes you may make a fist and put it on your chin, right? Or you may kind of grasp your chin and kind of rub your chin like you're thinking really hard, right? So this is termed the mental region because this is the area you may put your fist, put your arm, or put your hand and your fingers whenever you're thinking really hard. You put your hand on your mental region, okay? So these are areas around the head and neck, right? We also have ones kind of associated with our trunk. So things like the mammary region or the breast, the pectoral region, the chest, sternal region, the sternum, and then the axillary region is our armpit, right? Now, another extremely important reason you should learn these now is not only because you need to learn them for the test, not only because you need to learn them for um, whenever you're caring for your patients in the future, but because whenever we get to different body systems in the course, we're going to talk about the cardiovascular system in AMP2. You're going to talk about skeletal system in AMP1, muscular system, nervous system. There are going to be structures that are named according to the body region in which they're located. So a very good example of this is in AMP2. A lot of the blood vessels are named according to the region that they're in, right? So the blood vessel that runs in the axillary region, which is the armpit region, what do you think that blood vessel is called? It's called the axillary artery. What do you think the vein is called in that region? It's called the axillary vein. Here in a little bit, we'll look at um, we'll actually go to the next one. We'll look at the um, the arm, and we'll see that the brachial region, right, is the arm, which is our kind of upper arm. There's an artery and a vein that run there that are called the brachial artery and the brachial vein, right? Um, the acromial region in AMP1, we're going to talk about the scapula, and a point on the scapula is called the acromion process, okay? So the region of the acromion process of the scapula is just called the acromial region, right? So these names are very descriptive. So if you learn these body regions now, then when you get to it later in the semester with other systems and you get to it in AMP2, it's going to make much more sense, right? There's a point on your ulna. Whenever you kind of flex your arm as if you were flexing your bicep, your elbow, that's called your olecranon process, okay? That point of your ulna, there's a bone there called the ulna, and the point on it is called the olecranon process. Well, that region, when you're referring to just your elbow, the back of the elbow, is called the olecranal region, right? The olecranal region here, and you can see it right here. This is your olecranal region, okay? So looking at some here on the hand and fingers, right? We have carpal. Carpal is referring to wrist. We'll talk about whenever we do skeletal system and nervous system, something called carpal tunnel syndrome, which is the compression of a nerve, the median nerve in this region. And that nerve runs through the wrist region, so it's called carpal tunnel syndrome. Okay, manus is referring to hand or manual. Palmar is referring to palm. Pollex is referring to thumb. We'll have a similar one on the foot called the hallux, and this is referring to the big toe. Okay, and then digits are referring to your fingers and toes. Okay, so you use your digits to move into text. Now, an important thing about digits is typically when somebody says, you know, hold up your first digit or hold up one, you hold up your index finger, right? Now, anatomically, your index finger is your second digit. Your thumb is your first digit. So from now on, when you're counting on your fingers and you want to count 1, 2, 3, 4, 5, you got to start with your thumb as 1, and then you do your index finger for 2, middle finger for 3, ring finger for 4, and your pinky finger for 5. Okay. All right. Looking at a few more here associated with our kind of our back region. So dorsal in general is referring to back. Now, we'll talk about dorsal and ventral a little bit more in the course. Dorsal, you can also use the term posterior, and the other term is ventral. You can use the term anterior. Okay, we typically use the term anterior and posterior for us because we are bipedal, right? We walk upright on 2 legs. If something was walking on 4 legs, like a dog or an ape or something like that, it is sometimes more appropriate to use the term dorsal and ventral. Okay, but they're really interchangeable. So if you think of like the dorsal fin on a whale or the dorsal fin on a shark, it is on the back side or the top of the animal. Okay, lumbar is referring to low back, right? So if you have lumbar pain, this is your low back here. Sacral is referring to your sacrum, even more inferior than your lumbar region. Inguinal region is referring to your groin here. And then pubic or pubis is referring to your pubic region here, just medial to your inguinal region, okay, or medial to your groin, all right? Looking at the lower leg a little bit more, we have lots of regions here. The last one here. And again, these are very descriptive. So the femoral region, this is your thigh. There's a bone in your femoral region called the femur, so it's called the femoral region. You have your kneecap here, which is called your patella. So the region is called your patellar region, okay? Now there's some that have a very similar name, but they're different, okay? So an example of this is the crural region and the sural region, okay? Crural, the term crus or crural or crura means leg, okay? So anatomically, when we're talking about anatomy, the leg is everywhere between your knee and your ankle, okay? The thigh is between your knee and your hip, okay? So this is your crural region, the front of your leg. The back of your leg is called the sural, with an S, sural region, or your calf, okay? You have your popliteal region, which is the back of the knee. Calcaneal region is named this because there is a bone here called the calcaneus. Okay. Now, I actually want to go back just a second and tell you one additional thing about the arm. I just remembered I want to tell you real quick. For antecubital, I just thought of this, so forgive me. Antecubital region. This is another really important region for you to learn because there is this is a common site for what's called venipuncture, okay, or inserting an IV line, right, for blood draws and whatnot in a clinical setting. So oftentimes you'll see charted, especially if you're going toward nursing, The patient will have a certain gauge needle. They'll have a 20 gauge needle in their left AC. This means they have this size of needle, 20 gauge, in their left AC, their left antecubital region. So this antecubital region is the crease of your elbow on the front, right? That area right there. You have your brachial artery, and it will split into a ulnar and a radial. You also have some veins there, and it's the veins that are used during the venipuncture in this antecubital region. Sometimes it's referred to as just the AC region. Okay, so let me get back to where we were here. All right, so you have a few others. Pedal is referring to foot, hallux is referring to toe, right? So the best way to learn these, in my opinion, is after you kind of look at them labeled, is find a good image online or download an image onto your tablet if you have one or onto your computer and practice labeling these where there are no labels, right? So download a blank picture of the body and begin writing in where's the patellar region, where's the olecramal region, where's the mental region, and start drawing these, start drawing and start writing these labels in, okay? All right, so those are very external features, right? Those are very they're superficial, right? They're on the outside of the body. You can see them. I can look and I can see your patellar region. I can see your knee. I can see your mental region. I can see your odic region. I can see your cervical region, right? Now, for body cavities you cannot see, right? So they are a cavity. They're within the body. But we know that there are specific organs and organ systems, largely, that can be contained within these body cavities, right? So we have cranial cavity, we have spinal cavity, we have thoracic and abdominal cavities, and then within some of these cavities, we even have kind of subcavities, right? So the thoracic cavity is kind of everything from the base of the neck to where the diaphragm is, and the diaphragm is kind of right at the end of your rib. So if we're looking here, the diaphragm would kind of be running kind of right in here. So everything above this is going to be thoracic cavity. And within the thoracic cavity, you have a pericardial cavity with the heart. You have pleural cavities with lungs. You have a region called the mediastinum, which is kind of between the two lungs. Okay. You have abdominal cavity that has certain organs. Cranial cavity has the brain. Spinal cavity contains the spinal cord. Okay. You can then divide the cavities into a front and back. So dorsal cavity is the cranial and spinal, and then the ventral cavities are the kind of thoracic and abdominal cavities. Okay, and again, you have specific organs in these areas, in these cavities, and in a little bit we'll look at what are called abdominal quadrants and abdominal pelvic regions. And depending on where somebody is potentially complaining of pain or where somebody is potentially injured, depending on that location, you can deduce that a particular organ may be involved. Okay, so if somebody's saying, oh, my right, they're complaining of pain in their right upper quadrant, you can begin to suspect, okay, that could be their gallbladder. Or if they're saying, I'm having pain in my right lower quadrant, you can think, okay, that may be their appendix or something like that. Okay. All right. Now, in these cavities associated with certain organs, we have what are called serous membranes. Okay, and a serous membrane is it's really just one membrane, but it's kind of folded in on itself to give it two layers. Okay, and these membranes are associated with our heart, they're associated with our lungs, and they're associated with our abdominal viscera. Okay, largely a lot of our digestive viscera, so our stomach, small and large intestine, things like that. Okay, now for our serous membranes, there are always two layers. Okay, there's a layer that is on the organ itself. So imagine your fist. So the example I typically give in classes: imagine you have your fist, and then you make a fist with one hand, and then you lay your hand over your other hand over your fist. Right, you're kind of gripping your fist. That hand that comes over your fist, it is on the surface of your fist. Your fist is the organ, right? So that hand that comes over, that is the layer that's on the organ, and that is called the visceral layer. Okay, the term viscera means organ. Okay, we're going to use this term frequently in this course. So the visceral layer is on the organ. The other layer, called the parietal layer, is not on the organ, but it's surrounding the body wall around it, right? So if we look here at the heart, and we'll look at these in more detail in a second. But you have one layer on the surface of the heart. That's the visceral pericardium, in this case for the heart. And then you have a layer on the outside, which is the parietal layer, which is the parietal pericardium. Okay. Now, in between these two layers, there's a small space with a little bit of fluid, and this fluid is called serous fluid. Okay, and it serves to lubricate the two layers as they move past each other to allow, in this case, the heart to contract and beat. They may allow the lungs to expand or allow the digestive viscera to move easily past one another. Okay, so this cavity is this space in between, okay? And in class, I also use the example of a fist in a balloon, right? If you put your fist into a balloon, that layer of the balloon that's on the surface of your fist, that's the visceral layer, okay? The balloon then begins to kind of wrap around your fist, and then there's an outer layer, that's the parietal layer, and then in between those two, there's a space, that cavity, that serous cavity, and in that cavity there would be a little bit of fluid that serves as a lubricant to reduce friction between the two layers as that structure is moving. Okay, so if we look at it in more detail for the heart, this is called the pericardium specifically. Peri, the prefix peri means around. Cardia, cardiac, cardium, all these refer to the heart. And again, you can see the layer on the heart. This is the visceral layer. You can see the layer on the body wall. This is the parietal layer. And in between, you have that cavity. Or in this case, it's called the pericardial cavity because it's associated with the heart. Okay. You have the same thing for the lungs here. You have an outer parietal layer. You have an inner visceral layer on the organ, and then in between, you have a nice pleural cavity with, again, serous fluid. And then you have the same thing surrounding the abdominal viscera. So here you have a layer on the organ, right? So you have a visceral layer on the organ itself. You have a parietal layer out here lining the body wall, and then you have this peritoneal cavity with the serous fluid inside. Okay. Now the peritoneum is slightly different than the pericardium and the pleura because there are areas or there are regions when two layers of visceral um, uh, peritoneum uh, come together and they kind of merge together. And where you have two layers of visceral peritoneum come together and kind of merge and fuse, we call this the mesentery. Okay. Now the mesentery, you can see it here kind of on all this pink, these strands coming together. So if we look at, for example, if we look at this one right here. So this is a section of the small intestine, right? You have the visceral peritoneum around either side. It comes around on this side and goes up, and it comes around on this side and goes up. And where the two merge and fuse, that is called mesentery. And in the mesentery, you have blood vessels, you have nerves, you have lymphatics that are supplying the organs that are associated with. Okay. They also help to kind of suspend the digestive viscera, in this case, suspend the small intestine in the abdominal content. So you can see it's attached to this posterior abdominal wall, and then they suspend the small intestine and kind of allow them to hang down and move freely within this peritoneal cavity. Okay. All right. So if we look here at our this posterior cavity, we also have the brain. We have the spinal cord. So we talked about thoracic cavity with the heart and lungs. We just talked about the abdominal cavity with the digestive viscera, and now you have the posterior cavity, right? So this is the cranial cavity and the vertebral canal or the spinal cavity. These don't have these serous membranes in the same way that we just talked about with the heart, lungs, and digestive viscera. They do have layers that surround them. They're called meninges, and we'll talk about the meninges in more detail later in the semester, okay? But generally, these are encased in bone, so the vertebrae and the cranium. And again, in the cranial cavity, we obviously have the brain and sense organs, and then in our spinal or vertebral cavity or vertebral canal, we have our spinal cord. Okay. All right. So read this question and answer it. Pause it if you want. I'm going to go ahead and answer it. So which body cavity contains the heart? Spinal cavity, ventral cavity, pericardial cavity, or superior mediastinum? The best answer in this case would be C, the pericardial cavity, right? The pericardial cavity is a part of the ventral cavity. It's part of that anterior aspect, but the best answer in this case would be pericardial, specifically for the heart. Okay. All right, we're going to stop here and we'll pick up in the next part talking about abdominal pelvic regions and quadrants.